Hi everyone, thank you for joining. Today we'll be talking about the CDC prevention strategies for seasonal influenza in healthcare settings. Influenza is primarily a community-based infection that is transmitted in households and community settings. Each year, 5% to 20% of US residents acquire an influenza virus infection, and many will seek medical care in ambulatory healthcare settings. Influenza viruses have been thought to spread from person to person primarily through large particle respiratory droplet transmission. Transmission via large particle droplets requires close contact between source and recipient persons because droplets generally travel only short distances through the air. Indirect contact transmission via hand transfer of influenza virus from virus-contaminated surfaces or objects to mucosal surfaces of the face may also occur. Airborne transmission via small particle aerosols in the vicinity of the infectious individual may also occur. Now we will talk about the fundamental elements to prevent influenza transmission in healthcare settings. A multifaceted approach is required to prevent the transmission of influenza virus in healthcare settings. The core prevention strategies include administration of influenza vaccine, systematic strategies employed by some institutions to improve healthcare personnel vaccination rates have included providing incentives, providing vaccine at no cost to healthcare personnel, improving access, requiring personnel to sign declination forms to acknowledge that they have been educated about the benefits and risks of vaccination, and mandating influenza vaccination for all healthcare personnel without contraindication. Implementation of respiratory hygiene and cough etiquette. Cover your mouth and nose with a tissue when coughing or sneezing. Use the nearest waste receptacle to dispose of the tissue after use. Perform hand hygiene. Provide tissues and no-touch receptacles for used tissue disposal. Provide conveniently located dispensers of alcohol-based hand rub. Where sinks are available, ensure that supplies for hand washing are consistently available. Appropriate management of ill healthcare personnel. It includes measures but are not limited to excluding from work until at least 24 hours after they no longer have a fever without the use of fever-reducing medicines such as acetaminophen, instructing the ill healthcare personnel not to report to work or if at work to stop patient care activities, don a face mask and promptly notify his or her supervisor and infection control personnel / occupational health before leaving work, developing sick leave policies for healthcare personnel that are non-punitive, flexible, and consistent with public health guidance to allow and encourage healthcare personnel with suspected or confirmed influenza to stay home, etc. Adherence to infection control precautions for all patient care activities and aerosol generating procedures. Some of the precautions for aerosol generating procedures are limiting the number of healthcare personnel present during the procedure to only those essential for patient care and support, conducting the procedures in an airborne infection isolation room when feasible, considering use of portable HEPA filtration units to further reduce the concentration of contaminants in the air, etc. Implementing environmental infection control measures. Standard cleaning and disinfection procedures are adequate for influenza virus environmental control in all settings within the healthcare facility, including those patient care areas in which aerosol generating procedures are performed. Management of laundry, food service utensils, and medical waste should also be performed in accordance with standard procedures. Implementing engineering control measures. Examples of engineering controls include installing physical barriers such as partitions in triage areas or curtains that are drawn between patients in shared areas. Engineering controls may also be important to reduce exposures related to specific procedures, such as using closed suctioning systems for airway suction in intubated patients. Another important engineering control is ensuring that appropriate air handling systems are installed and maintained in healthcare facilities. Here you will find the reference that was used to create this video. If you like this video, why not click like and let us know. Thank you for watching. See you next time.